Hi, I'm Dr. Langdon, and today we're going to talk about using Botox on the face. And one good question is, what is the best area of the face to use Botox? So generally, Botox is used for the muscles on the upper part of the face. And Botox is a neurotoxin as well as its other similar neurotoxins such as Xeomin and Dysport and Jeuveau. And they all work pretty much the same way. So they will inactivate muscles. So they work on the nerve ending where the nerve ending interfaces with the muscle, and they permanently inactivate the nerve ending. The problem, though, is that the nerves that where they interface with the muscle will grow new nerve endings, and there's no way to stop that. So the effect of Botox will always wear off, and usually it will last for 3 or 4 months, and you'll gradually see the muscles regain their strength. So the muscles that we are talking about are the superficial muscles. These are called the muscles of facial expression, and they are designed to make the skin move. And that's how you make expression. So whether it's a frown expression, or squinting, or raising the eyebrows, or smiling, all of those are examples of the superficial muscles making expressions. And so we can see these on diagrams as presented here. So, of the various muscle groups that are treated, the most common of all is probably the frown lines. And I can demonstrate on with a mirror on myself. So I happen to do my own Botox. Lately, it's been Jeuveau that I have used. So in the frown area, which is called the glabella, right here between the eyebrows, when someone makes a frown expression, their eyebrows are drawn together. And because I've had some fairly recent treatment with Jeuveau, they're not coming together like, really strongly like this. So I don't really have any deeper furrows. I did have, and I don't really have any frown lines either. So when I am totally relaxed, you can't really see any wrinkles. I did have frown lines, and the last time I had them was 1995. So that was before I had my very first Botox treatment. And then I had a laser treatment, laser resurfacing to smooth the skin. So another common misconception is that people think that when they do a treatment with Botox that the wrinkles will disappear. And they won't disappear. What disappears is that deepening of wrinkles that occurs when the muscles are contracting. So we differentiate between static wrinkles and dynamic wrinkles. So static wrinkles are when your muscles are totally relaxed and they're present all the time. They're etched into the skin. They are a skin feature. Dynamic wrinkles are when the muscles are contracting, and that's when you can get a great worsening of the muscles. You can get really deep furrows, for example, in the frown line area. So it's important to differentiate between the wrinkles that are always present. Those can be treated with a skin treatment, whether that's an injection with a filler, like a hyaluronic injection, or with even more effective is laser resurfacing. So if you consider the different parts of the face, where Botox is used, the very best area, because there's nothing negative, there's no downside about it, is the frown line area. So when that area is treated, you try to make a frown, and you do not see the eyebrows coming together. Frowning is always a negative expression. So if you want to look mean or angry, frowning is a great way to do that. And normal people don't really have to frown. So if you're an actor and you have to play the bad guy, then you have to frown. If you have to look mean for some reason, then frowning is a great way to do that. But it's okay if you can't frown. No one's going to notice, except they will think you're in a good mood, whether you are or not. So that's why it's never a problem treating frown lines. There's no negative aspects to that. Another common area treated is the forehead. And when I raise my eyebrows like this, I'm using the frontalis muscle. There's one on each side to raise the eyebrows. So that is a dynamic wrinkle that is a, that results from the active contraction of that muscle. So the forehead can be treated. It's also commonly done. There is a downside though. If you totally paralyze the forehead muscle, your brows will actually sink to a lower level, and that can make the eyelids look worse. We do a procedure called blepharoplasty to remove excess skin from the upper eyelid, and some of them might have more of a need for a blepharoplasty if their eyebrows have sunk to too low a level. So there's a little bit of a trade-off there. It's not ideal. It certainly can be done. The goal in the forehead should be to weaken the muscles, but not to totally paralyze them. Another common area treated is the crow's feet, which are the wrinkles to the side of the eye in the temple area. Those also can be done. The muscle is the orbicularis muscle, which is this round muscle that goes completely around the eye. And the part on the side is what is, when you contract that area, you get this crow's feet type wrinkling. So this can be done, and one reason it's not sometimes ideal is that when people smile, everyone's a little bit different. But in my case, this is the squinting that can be done, treated with Botox. When I smile like this, I'm using larger muscles that are pushing the cheek up, and the wrinkling is much worse when I smile. So I might be a little bit disappointed if I'm treating the crow's feet area, but it can be done. And for most people it is helpful. But again, the number one best area for treating using Botox is the frown line area, the glabella. Okay, thank you.